Everything you need to know about constipation. Constipation is a common digestive issue characterized by infrequent bowel movements, difficulty passing stools, or a sensation of incomplete evacuation. Here's a comprehensive overview of constipation, covering its causes, symptoms, diagnosis, treatment, and prevention. Causes of constipation. Dietary factors. Lack of fiber in the diet. Inadequate fluid intake. Consuming a diet high in processed foods. Lifestyle factors. Lack of physical activity. Ignoring the urge to have a bowel movement. Changes in routine or travel. Medical conditions. Irritable bowel syndrome, IBS. Hypothyroidism. Diabetes. Neurological disorders. Colorectal disorders, e.g., colorectal cancer, anal fissures. Medications. Certain medications, including some painkillers, antacids with aluminum or calcium, and certain antidepressants. Psychological factors. Stress and anxiety. Age and hormonal changes. Older adults may experience constipation more frequently. Hormonal changes during pregnancy. Symptoms of constipation. Infrequent bowel movements, typically fewer than 3 bowel movements per week. Straining during bowel movements. Hard or lumpy stools. Feeling of incomplete evacuation. Abdominal discomfort or bloating. Diagnosis. Medical history and physical examination. Your healthcare provider will inquire about your symptoms, lifestyle, and medical history. Blood tests, to rule out underlying conditions like hypothyroidism or diabetes. Imaging tests, in some cases, imaging studies like colonoscopy may be recommended. Treatment. Dietary changes. Increase fiber intake with fruits, vegetables, and whole grains. Ensure an adequate fluid intake. Lifestyle modifications. Regular physical activity. Establish a regular bowel routine. Medications. Fiber supplements. Laxatives, short-term use under medical supervision. Biofeedback or physical therapy, for certain cases related to pelvic floor dysfunction. Prevention. Maintain a healthy diet. Eat a diet rich in fiber. Include fruits, vegetables, and whole grains. Stay hydrated. Drink plenty of water throughout the day. Exercise regularly. Physical activity can promote bowel regularity. Establish regular bowel habits. Try to have a bowel movement at the same time each day. Respond to the urge. Don't ignore the urge to have a bowel movement. If constipation persists or is accompanied by severe symptoms, it's crucial to consult a healthcare professional for proper evaluation and guidance tailored to your specific situation.